The term hemostasis refers to the stoppage of bleeding. Okay? And it generally begins with vasospasm. In other words, when you cut through tissue, you're damaging tiny blood vessels, and those vessels reflexly undergo vasospasm. Of course, in doing so, you reduce blood loss. You're going to lose less blood out of a smaller diameter vessel than out of a larger diameter vessel. The second thing that occurs is a platelet plug forms at the site of vessel damage, and that plug helps to stop the leak. But that plug is kind of a temporary fix. It gets reinforced by activation of clotting factors and subsequent coagulation of blood. Coagulation of blood involves formation of a fibrin mesh at the site of the damage. And then later what happens is fibroblasts move into the area and they perform vessel repair. So eventually that damage heals. When we first talked about blood, we said that there were two elements within the blood that participate in hemostasis: platelets and clotting factors. The most abundant clotting factor would be fibrinogen. Let's talk first about platelets. They help blood clot, but they're different from red blood cells. They only live 7 to 10 days, so they're relatively short-lived. The other thing you need to know about platelets is they're not cells. They are fragments of cells called megakaryocytes that are found within the bone marrow. Within the bone marrow, you find these huge cells that are multinucleated. And these are called megakaryocytes. Fragments of these cells pinch off, leave the bone marrow, and enter the bloodstream. These fragments are platelets. We mentioned that platelets are going to participate in formation of a platelet plug at the site of vessel injury. If somebody has an abnormally low number of platelets, or alternatively if they have dysfunctional platelets that don't work, they can have some problems. Low numbers, for instance, can lead to bruising. Petechiae are tiny dots, tiny red dots, which represent very tiny hemorrhages from capillaries. Nosebleeds and internal bleeding. These are all the consequences of an inadequate number of platelets. There's a term for low platelet count: thrombocytopenia. You've seen the suffix penia, P-N-I-A, before. We talked about leukopenia being an abnormally low number of white blood cells. Well, thrombocytopenia is an abnormally low number of thrombocytes. And a thrombocyte is simply another name for a platelet. So thrombocytopenia is an abnormally low platelet count. One time I had a lady bringing her little girl because of a rash. And what the child actually had was petechiae across all of her body, all of her skin, and even if you had her open her mouth, you could see the petechiae along the palate. So I told the mother, I said, I don't think this is a rash. I think these are little sites of hemorrhage. And so what blood test did we perform?
CBC.
A CBC, a complete blood count, because that will provide information with regard to number of red blood cells, white blood cells, and platelets. And indeed, she had thrombocytopenia that accounted for a clinical presentation.
Why do, like, my daughter's had petechia from coughing excessively before. Why does that happen?
Because when you cough, you increase capillary pressure. You build up pressure and it causes some of those tiny capillaries to bleed. So in this slide, we see damage to a blood vessel here. Okay? Now, when a blood vessel is damaged, there's disruption of the endothelial lining. Okay? And with that disruption, you expose collagen within the tunica intima, within the inner lining of the vessel wall to the bloodstream. Okay? When collagen is exposed, the platelets are going to adhere to that site of damage. Okay? So that's the first step in a platelet plug formation, is that platelets adhere to the site of damage. Okay? Now, when they adhere, they subsequently become activated. They change shape and undergo release of chemical mediators. Okay? That's what we see here, a platelet release reaction, where you can see the platelets beginning to change shape as they adhere and release chemical mediators that bring about platelet aggregation. It causes other platelets to come in and form a little clump that covers the site of damage and prevents any leakage from that site. It's a temporary fix. Okay. So in the processing of hemostasis, the first thing that occurs within seconds is that the platelet undergoes vasospasm. The second thing that occurs is a platelet plug forms at the site of damage. Okay. Now, we talked about the release reaction. When platelets adhere, they release chemical mediators, including ADP, adenosine diphosphate. Other platelets within the bloodstream have receptors for ADP. Okay? And so as ADP binds to platelets that are circulating past the area of damage, it causes them to undergo aggregation, to clump at the site of the damage. And as they bind, they too release ADP. So it's kind of a cascade. It kind of builds upon itself. Now, as these platelets are aggregating at the site of damage, they form a plug. But in addition to releasing ADP, these platelets that are aggregating release other chemical mediators like serotonin that reinforce the initial vasospasm, that reinforce the reflex vasospasm that occurred at the time of the damage. And then these platelets also release phospholipids, which participate in the coagulation cascade. They help to reinforce coagulation, okay, forming a second, more stable plug called a fibrin plug, or it's also called a thrombus. Okay. Now, with formation of a thrombus, what we have to do is activate circulating clotting factors. So as the platelet plug is being formed, we're beginning to activate what's called the coagulation cascade. We're beginning to activate circulating clotting factors that lead to formation of fibrin. Okay. The inactive form of fibrin is called fibrinogen. Anytime you see an O-G-E-N ending to a word, it means it's inactive. Okay? But as a result of the clotting cascade, the coagulation cascade that we're going to discuss, fibrinogen is cleaved and converted to fibrin. Whereas fibrinogen is soluble within the plasma, when it's converted to fibrin, it's no longer soluble. It precipitates out of solution as tiny threads. And these threads are very, very sticky. They bind to platelets, they bind at the site of damage, and they form a little meshwork that traps red blood cells, that traps platelets and white blood cells, and they occlude the blood vessel, so it stops bleeding. So the coagulation cascade is going to result in formation of a fibrin plug. And so this is just a little diagram that shows what happens when there's injury to the lining of a blood vessel. Okay? We said platelets adhere. They're going to form a little clump of platelet blood at the site of damage. But these platelets are going to release chemical mediators that are going to contribute to the formation of a fibrin mesh, a thrombus. Okay? How do they do so? Well, as the platelets are activated, they release phospholipids that accelerate the coagulation cascade. Okay? Those phospholipids, as well as other clotting factors within the blood, are going to lead to activation of a clotting factor called prothrombin. When prothrombin is activated, it forms thrombin, and thrombin is the activated factor that converts fibrinogen to fibrin. Let's see how this occurs. There are two different pathways by which blood can coagulate. One is called the extrinsic pathway, the other is called the intrinsic pathway. And what you'll notice is that these pathways eventually converge. Okay? Now, each pathway is a sequence of reactions in which one inactive clotting factor is converted to an active factor. And then that active factor in sequence activates another factor. So that with the coagulation cascade, and these aren't the correct numbers, but if you have an inactive factor, okay, let's say factor 1, it's going to get converted to activated clotting factor 1. And then activated clotting factor 1 is going to convert factor 2 to its activated form. Factor 2 is going to activate factor 3 into its activated form. So one factor activates the next in these pathways until ultimately you activate the final clotting factor, fibrinogen. Does that make sense? And so this is called a cascade. Again, it involves two different pathways, an extrinsic pathway and an intrinsic pathway. The term extrinsic means that the factor that triggers activation of this pathway occurs outside the bloodstream. Okay. The name of this factor that activates the extrinsic pathway is called tissue factor. It also goes by a different name, thromboplastin. It can also be called factor 3. We use Roman numerals. So when there's damage to tissue, the damaged tissue releases tissue factor, or thromboplastin, that then diffuses from the wall of the vessel into the bloodstream, where it activates circulating factor 7. So tissue factor, thromboplastin, is going to activate factor 7, which in turn is going to activate factor 10. Activated factor 10 is the first step in that final common pathway where the two pathways merge. We'll come back to that. So this is called the extrinsic pathway, and it's relatively short. It's simply tissue factor being released from the tissue, diffusing into the bloodstream, and activating factor 7, which in turn activates factor 10, okay, which brings us to this final common pathway. The other pathway is called the intrinsic pathway. It's called the intrinsic pathway because the trigger for activation of this pathway is found within the bloodstream. So it's intrinsic to the bloodstream. When there's damage to a vessel, then the bloodstream is exposed to collagen, a protein found within the inner vessel lining. So that collagen is internal to the bloodstream. It's exposed to the bloodstream already. Exposed collagen activates circulating clotting factor 12. And we can see with this pathway, 12 activates 11, which activates 9, with the help of 8, activates 10. I'm not going to ask you to know the exact sequence of reactions that occur in each of these pathways. But notice again that these pathways converge. Both routes lead to activation of factor 10. Now, factor 10 is going to join with some other co-mediators, like phospholipids released from platelets, and calcium, okay, and factor 5. And this complex is going to serve to activate prothrombin. We can call this complex either prothrombinase, or we can call it prothrombin activator. But when activated 10 gets together with 5 and 8, and calcium and phospholipids, this complex then is going to serve to convert prothrombin into thrombin, and thrombin then converts fibrinogen to fibrin. Fibrin is going to precipitate out of solution as a thread-like mesh, because remember, these are sticky threads that bind together, and they're going to form a more stable thrombus at the site of the platelet plug. If we were to, and this is just an abbreviated representation of the sequence of reactions, intrinsic versus extrinsic, ultimately leads to conversion of prothrombin to thrombin, which converts fibrinogen to fibrin. Now, this is what, if you take an electron microscope and look at a clot or a thrombus under that microscope, you would see a picture that looks like this. These are fibrin threads. Okay, you can see that it's going to attach any of the red blood cells and white blood cells that are trying to pass through, and eventually it's going to form a clot, which occludes that broken blood vessel and prevents it from bleeding further. So the thrombus that forms as a result of activation of the coagulation cascade is much more stable than the initial